Hello everyone, welcome to OBG Nursing. Today, let's learn about per vaginal examination. Okay, so let's start with the definition about per vaginal examination. It is a clinical procedure to assess the condition of vagina, cervix, membrane. Membranes means it is the amniotic sac presenting part, whatever is there on the cervix. That might be a head, face, buttocks, anything that you need to assess that. And pelvis. In pelvis, we see whether it is a favorable or not favorable for delivery. And this per vaginal examination is commonly done during labor time, and it is also done during term pregnancy, that is at 37 weeks of gestation. Okay, so indication for per vaginal examination. When are you supposed to do this per vaginal examination? First is to confirm the onset and the progress of labor. Okay. Second is to assess the cervical dilatation and effacement, which is like one, whether it is 1 centimeter dilated, 2, 3, 5, whatever. And effacement means the percentage of the cervix that has been part of the uterus. And number three is to detect whether the membrane has been ruptured or not. And then you have number four, identifying the presenting part and its station. Station means how far the head has descended from the ischial spine. And then to evaluate the pelvic adequacy. Okay, so preparation. Uh, Number one, make sure that you taken verbal consent. This is very important. Number two, ensure privacy. This comes under respectful maternity care. And number three, explain the procedure to the mother so that she is not anxious and she is confident in you. And number four, use a gentle and respectful approach. Okay, so before we do the PV examination, we first need to clean the perineum. Okay, for that, ask the mother to lie down in a supine position and her knee should be bent. Wash your hands and put on a sterile gloves. After that, make sure the privacy is maintained. It is very important. Number four, use sterile swab or sterile gauze paste. As I said earlier, PV examination is a sterile procedure. For now, for cleaning the perineum, start from clitoris down to the anus, from top to bottom. The one gauze should be used only once. Once you have used it, you need to discard it. Okay, and then same with the labia majora and labia majora right and left, and labia minora right and left. So total of 5 times. But then if you see, or if you feel that the perineum needs to be cleaned a little more, then you can do it more. Okay, as I said, number six, as I said, the principle is one gauze piece, one stroke. Now steps for per vaginal examination. First is inspection. Check for excessive discharge and see whether there is a foul smelling discharge or not, and also see whether there is blood or not. Okay, so now PV examination. Once you have washed your hands, wore your sterile gloves, and cleaned the perineum, you need to now apply a lubricant to the gloved finger, especially the index finger and the middle finger. Now, after that, insert the index finger gently first and then middle finger of your dominant hand into the vagina. After that, what do you need to assess? In vagina, check for the elasticity of the vagina and any abnormal growth. Number two, cervix. Check for the position of the cervix, okay, whether it is in the anterior or posterior or it is in the mid. So because when the mother is in the early labor, you'll feel the cervix, or you'll find the cervix in the posterior side. So as the labor progresses, the cervix comes into you'll feel the cervix in the middle. Okay, consistency means whether the cervix is firm or soft. Okay, effacement is the cervix being part of the uterus. As the dilatation happens, the cervix slowly gradually moves upward and becomes part of the cervix, of the uterus. That is called effacement. And then dilatation. how the opening, okay, whether it is 2 centimeter, 5 centimeter, 8 centimeter, okay. So that you need to check. In membrane, whether the membrane has been ruptured or not, that you need to check. The membrane, you'll feel a balloon filled with water, okay. And now presenting part. One, if the membrane has been ruptured, you'll feel the presenting part, whether it is head, breech, or shoulder, face, okay. So what is it, you need to check there. That station is what is if the present, suppose if the presenting part is the head, how far the head has descended from the ischial spine, okay. That is the station. So when we write about station, we say ki it is 5 positive, or 5 plus, or sorry, 5 plus, 2 plus, 3 plus, like that. Or if it is above the ischial spine, we say it is -5, -2, -3, like that, okay. And then pelvic, we need to check for the adequacy of the pelvic, because to know whether a vaginal delivery is possible or not. In detail, we'll learn in the further slide. After that, you need to withdraw your hand gently and dispose the gloves, and record the finding. Okay, so now let us understand pelvic adequacy. Okay, why we do pelvic? Why do we assess the pelvic adequacy? The purpose of doing is to understand or to check whether the pelvic is adequate for normal vaginal delivery. Okay, for that, first what you need to do is, if the head is not engaged, what do you mean by engaged? Which means if the head has not come up till ischial spine, then what you need to do is, you need to try to feel the sacral promontory. This is the bone, this bone, the sacral promontory, you need to feel this, okay. So if you are able to feel this, that means the pelvic is contracted, it is not good, okay. But then if you are not able to feel this, then what do? The second thing that you need to do is check the sacrum, okay. The sacrum should be well curved. The sacrum should be, this should be well curved. If it is well curved, then it is favorable, then it is good, okay. And then you come little down, then spread your two finger, the index finger and the middle finger, try to touch this ischial spine, this this pointed bone. Try to feel this. At the time, if you are able to feel at the same time this two bone, this means it is contracted, the pelvic cavity is contracted, okay, and it is not favorable, okay. Third thing that you check. And now you take out um, the finger, and what you need to do is, you spread the two finger here at the pubic angle. If you are able to fit it easily, if the two finger is easily accommodated, that means the outer outlet, which means the baby can come out easily, it is, that means it is adequate. And now the other technique of assessing whether the outlet is adequate is not, the other thing is that you need to make a fist, four knuckles, okay. Place it between the two ischial tuberosity. This is the ischial tuberosity. So place it between this two tuberosity, and then place your fist there. If it if you are able to fit it easily, that means the posterior outlet is adequate, okay. So this is how you need to assess the pelvic adequacy. Thank you. If you find it helpful, then please do share with your friends, and do not forget to like and subscribe. Until then, see you in my next video.